Well, hi everybody. Let me again apologize for canceling class with little notice yesterday. Like I said, I had some dental work done and I could not open my mouth very wide, and it was pretty painful. So you guys got the night off. I know it wasn't all bad, even though I'm sure you missed hearing from me last night. Tonight I was going to talk to you about epilepsy and seizures. And I also was going to use this as kind of a model of the kinds of content I'm looking for in your student presentations. Also during this recording, I'm going to give you a very simple format for the emergency plan that is part of your healthcare plan that you'll be turning in. So this has some good information for you and some useful tools for you. So I hope that you will take the time to actually listen to the recording. So just as a reminder, your student presentation should contain the name of your condition. Remember, if some of your conditions may go by different names or have different variations of the condition, make sure that you list any alternate names for your condition. The etiology and diagnosis of the condition. Etiology just means what's the cause or the set of causes for that. Sometimes there is not a cause, and sometimes there is. So if there is a cause, then we'd like to hear about it, and then how is that condition diagnosed. The most important part of your presentation, though, is going to be the educational implications. This isn't always apparent in what you're going to be reading as you do your research for your condition. So it's very important for you to use those kind of higher level thinking skills to think about what are those tasks that we ask students to do in class, both academic tasks, social tasks, self-care tasks, all those kinds of things, and think about how that condition might impact a student with that condition at school. I want you to talk about when that condition would be eligible for Section 504 or an accommodations plan, and if it gets to the point where it would be considered eligible under IDEA, what would that look like and why? Then I want you to talk a lot about, the most about accommodations, modifications, and adaptations. We also want to think about the social and emotional implications of that condition. It's not just enough for us to think about how that child might be affected cognitively or academically. We also want to think about the social impact, emotional impact of that condition. The next area I want you to talk about would be support groups that are available. And remember, a support group is something that's interactive. It's not just an informational website or a resource, but is actually something where there is person-to-person interaction. That could be a live support group in your local area. Remember, we want it to be something that if you were teaching and this kind of student walked into your classroom, it would be a resource you could provide to that student or to that parent. So we don't want anything out in Alaska, unless you're living in Alaska right now. We want something in a reasonable distance from where you physically are if you're going to do a live face-to-face support group. But there are a lot of support groups and support availability available online. So if there's not something like that, or if there is and you just want to also provide some information about online support groups, that's great. Just remember, it has to be interactive. So things like live chats or an interactive Facebook group or like a message board. It doesn't have to be live necessarily, but it does have to be interactive. Any professional journals that are associated with the condition. Remember, this is going to be a little tricky. Sometimes there are lots of journals that are dedicated to that condition that are really medical in nature, and that's fine, but what we're really looking for is something that might have resources for us at school. So you might want to look into things like the CEC Division on Physical and Health Disabilities. They have a journal. It may not be solely dedicated to your condition, but maybe there's a special issue, or you say, you know, well, there isn't a specific journal for this. These are the types of journals that sometimes have articles related to this. Several school nursing associations have journals and things like that. So you might have to dig a little for that, and you likely aren't going to find something that you think is just spot on, and that's okay. Now, the next bullet is online informational sites associated with the condition. So that's where if you find something that's really good information, but you wouldn't really consider it a support group, this is where you put that information. Now remember, we want to kind of vet that and analyze that site and make sure that it is a reputable site. So things like national associations or nonprofit organizations. Those are the kinds of things we want to look for. You know, anybody can have a website nowadays, so we want to make sure that we don't just put any old thing. We want to put something that we think has, you know, a high likelihood of having something credible. References, I'm going to kind of just mention that now because on the next slide we're going to go a little more into this, but preferred references are refereed journal articles or peer-reviewed journal articles. That is not website articles unless it is an actual journal that has they online publish them as well. So journal articles, you can find that through our school library or things like Google Scholar, but that's our preferred place for information. There are some reputable professional online associations that may have some resources that are also acceptable. But if you're in doubt, don't, and even if you want to use something like a resource that you think is good, we're not going to count that in your minimum number of references, and that's going to be on the next page. And because graduate school requires that we analyze your writing and your speaking, I'm gonna assess you on writing and speaking as far as how your presentation and your thoughts are organized. And conventions just means grammar and spelling and things like that. I do realize that when you're speaking, it's a little more difficult to always be as accurate as we would like as when we're writing, and we can double check and spell check and things like that. But it is important as you go through your graduate education that you get used to speaking and you get used to speaking in a professional manner. So that's important. So because we do have students at various levels in class, we are requiring in multiple classes, you may see some differentiation in assignments. This is one of those areas. Master's students, you need to have at least 7 professional references, not including the book chapter if the book has a chapter on your condition. Of these 7 references, at least 4 must be from peer-reviewed journals. So if you have the book chapter from our textbook, that does not count in your 7 references. So 7 additional. Specialist students, 10 references. 10 of the 10, 6 must be peer-reviewed journal articles. And doctoral students, at least 12 references, and 8 must be from peer-reviewed journal articles. So remember that as we go into the next several weeks with student presentations. If you have a question or you have doubts about if something is reputable or not, just shoot me an email and I'll take a look at it for you. All right, so let's talk about epilepsy and really any seizure disorder. This is something very common. There'll be several children at your school and sometimes children in your class that have epilepsy or some kind of seizure disorder. So this is just an example of the name of condition. So etiology, what might cause a person to have epilepsy? So here are some of the reasons that we might see this. It might be that they had low oxygen during birth. Head injuries can cause epilepsy, either head injuries during birth or even during an accident later in life. Brain tumors can cause someone to have seizures. Genetic conditions that have brain injuries such as tuberous sclerosis, that's one condition that always results in the person having seizures. If the student has had meningitis or encephalitis, they could then have epilepsy or seizures. After that, if they have had any kind of stroke or any other kind of damage to the brain, that can cause someone to have epilepsy or just a seizure disorder. Abnormal levels of substances like sodium or blood sugar can trigger seizures. But in up to 70% of all the cases of epilepsy, we don't know what caused it. So while we know that these things do cause sometimes people to have epilepsy or have a seizure disorder, up to 70% of the time we don't know what caused it. So this is just, again, an example of how you might talk about etiology. Now, I would say this is a lot of information on one slide. If I were critiquing myself, I might say, hey, maybe, put half of these on one slide, half on another, maybe have some kind of graphic. Just areas for improvement. How is epilepsy or a seizure disorder diagnosed? There are several different ways, but always a neurological exam is done, including neurological tests. So most commonly it would be an EEG, an electroencephalogram. I can't say it. Practice those hard words in your presentation. That's the next tip I'm going to have for you. Sometimes a CT scan or an MRI or a functional MRI, PET scan, a SPECT test, or any other kind of neurophysiological tests are done. And then also some blood work is done to diagnose seizure disorders. But now we get down to the meat of it. So what do we need to know about epilepsy at school? So we have to know that most children with epilepsy have average or above intelligence. They perform just fine academically, and they really don't need a whole lot of assistance in transitioning. So this tells me that probably most students who just have a seizure disorder, they don't have another kind of condition that goes along with it or a syndrome that goes along with it, they're most likely to be covered under Section 504. Some have concomitant, that just means happens at the same time. They have concomitant disabilities, so things that are as a result of their epilepsy or in addition to, that can affect school performance. So over time, the more seizure activity a child has, the more impact on cognition and on their brain that happens. So the frequency of seizures can really kind of start pushing the needle over into the, yes, we are starting to see some academic impact. There are several things that are associated with epilepsy that have the potential to impact school performance and that are easily overlooked. And sometimes these are mistakenly thought to be something like lack of motivation because the learning difficulties are not consistent. So it could be kind of cyclical where a child is well managed and we don't see a lot of those learning impacts, and then they start having several seizures and they're not so well managed, and we overlook some of the things that are happening for that student. So the Epilepsy Foundation of Michigan, this is a nonprofit, and they are a very reputable nonprofit. They have some information actually on their website. This would be an area of online information. This would not necessarily be a support group. But they have some factors that can affect school performance. So they state that seizures can result in students missing information, especially if there are seizures that aren't the kind of grand mal or those tonic-clonic seizures where the student is obviously having a seizure. They can have these little petit mal seizures or absent seizures where they just kind of seem to space out, and so we don't really realize that they're having a seizure, and it may just look like they're not paying attention. That can also disrupt the memory function, so that sometimes even the information that's provided just prior to a seizure doesn't make its way into short-term memory, and therefore it doesn't ever make its way into long-term memory, and so the student just doesn't have any recollection of that. So not only the period after the seizure can be important, but also the period before the seizure and obviously during the seizure. Postical effects. The period after some seizures can be associated with memory dysfunction, sleepiness, confusion. These are the things that we are more likely to see. So after the seizure, of course, the student might have a little confusion. They're going to be sleepy. They're going to maybe not remember some of the things. Things are going to be real foggy. They are going to need some time to rest and recuperate after that. And then there are some interictal epileptiform discharges, abnormal electrical activity in the brain that takes place between the seizure can cause temporary changes in cognitive function like alertness and processing speed. So all of these things can have a major impact on the student's ability to learn. They also can start having some structural brain abnormalities. Intractable epilepsy just means that the epilepsy is in one spot in the brain, exactly in the hippocampus, and it's something that every time that person has a seizure, it's in that part of the brain. And that is the part of the brain that is where we have our memory and other cognitive functions. So when there is epilepsy that's causing problems and electrical activity in that part of the brain, of course we're going to have more significant learning problems. And then the medications that these students take have a lot of side effects. Most notably, that makes them very sleepy sometimes and things like that. So the medication side effects are very serious and need to be considered. Sleep disruption is another thing that happens when a person has epilepsy. They don't get enough high quality sleep. Sometimes the sleep patterns, the sleep cycles are disrupted because of the irregular brain activity. And so sleep deprivation is very common in people with epilepsy. Depression and anxiety are more common in children with epilepsy more than the general population. And this can, of course, have an impact on their functioning, their motivation, and definitely their confidence. This is something in your handouts. This is a whole page. And so at this point in your presentation preparation, you should be thinking, okay, is this child going to qualify under 504, which we know all the conditions we're talking about do qualify under 504, or is the impact for this child or this condition more going to be likely to be covered under IDEA? So this is just that flow chart that I showed you, I think last week, but you have it in bigger form now. A little tool for you. So just to summarize, some possible educational implication: missed instruction, poor work completion, cognitive and academic impairment, interpersonal and emotional impact. So now let's go a little deeper about how can we address the cognition impacts. So now we know how they might be impacted at school. So now what are we going to do about that? So when a child has seizures or seizure disorders, it's helpful to provide written instructions if they are so young they can't really read, or if they have other cognitive disabilities and maybe can't read, maybe picture instructions for them. So if they are having some difficulty, having written instructions is great. Using voice recordings of verbal instruction, another strategy we can use. Having a peer in the class take notes or permit them to record the class. Dividing large tasks into smaller tasks so that if they're doing multi-step activities or multi-step assignments, then they get kind of partially through and then they lose track of where they are, what they were supposed to do. If we have things divided into smaller chunks, that can be helpful. Providing a checklist of assignments or a calendar with due dates is also very, very helpful. And sometimes we need to decrease the memory demands, especially if they're very active, they have a lot of active seizures. Sometimes, using recognition rather than recall tasks. That's, for example, having a multiple choice test instead of an essay test might be something that would be helpful, so that that's kind of a, it helps with recall of information that maybe they're having trouble pulling back out because of the abnormal activity in their brain. Now, if you think about this, a lot of these things aren't specific necessarily to children with epilepsy, but these would be helpful for children with a wide variety of educational needs, or maybe students that don't have educational needs at all, but are absent one day, or things like that. So these all fit pretty nicely into universally designed classrooms like we were talking about a few weeks ago. To address their health concerns, we need to make sure that we're flexible about time missed from school, and understand that they're going to need time to go for treatment and adjust to new medications. We might often need to provide extra time for assignments or even a modified workload, because fatigue is very common in this population. Some people are very sensitive to fluorescent lights. They kind of have a little flicker, and if a person has epilepsy, that might be something that triggers some seizures. So sometimes it's better to not have fluorescent lighting in the classroom, but we have just regular full spectrum lighting or regular light bulbs in the class. And it's always nice to have a private area that the student can go to after they've had a seizure to rest for a while. Students don't always need to necessarily go home after a seizure, but they do need to have some time to rest and recuperate. Again, missed instructional days for this population is going to be huge, and you guys know that this is kind of one of my areas of interest, is how much time can kids miss before it starts catching up. So there's a study that found that during a 6-month interval, nearly 30% of students with epilepsy miss 5 or more school days, and kids that were more recently diagnosed miss more than that. 70% of parents in a similar study said they'd permit their child to miss school even on seizure-free days. So this goes back into parents sometimes can be a little overprotective, and they might keep them home more often than they do. So we need to encourage parents to affirm the necessity of regular school attendance, and help parents avoid overprotection by having confidence in us, and that knowing that we know what to do, knowing that we're going to be there for their child and their child's going to be safe with us. And families that successfully adjusted to their child's disease, and again, those with positive school-family relationships. So if they know that we have plans in place and we have the right kind of knowledge and we know what to do, the students are less likely to miss school. Parents with lower educational attainment and limited knowledge about their child's epilepsy predict attendance problems. So we know that when a parent has lower educational attainment, or they just don't know a whole lot about their child's disability, their child misses a lot more school. So that's missing days, missing instructional time. Seizures cause missed learning experiences. Sometimes the seizures are subtle and they're hard to detect, and so students may miss directions. They may take longer to complete their work, and they multi-step problems, especially as they start getting into high school. I'm thinking high school math, that can be very, very difficult if they're having several small seizures that aren't necessarily apparent to the teacher. Immediately after the seizure, they're often confused, and so that's going to, of course, lead to a lack of comprehension of instruction or remembering new material and memorization. Another thing that's variable is the students' or the teacher's receptiveness to instruction after a seizure. In fact, one study found that 2/3 of students who have a seizure at school immediately go home. And again, that is not necessarily medically indicated that if they have a seizure, they have to go home. There are students who can have a seizure at school. Of course, we document it. We make sure, keep an eye on them, but if they have a little rest time, they can just return to school and not need to necessarily go home. So in the classroom, what do we do for teaching? If we're teaching, this is some information from Massachusetts General. They also have some really nice things on their website, reputable source. Focus less on retrieval of information and more on recognition tasks. Repeat material a lot, give a lot of redirection, sometimes cueing, and focusing on learning strategies such as mnemonics when we do have to focus on recall. That one's duplicated. The first one, obviously, sometimes we're going to need to give extra time for assignments and exams. Sometimes we're going to have to give non-timed assessments if we're able to do that. Again, breaking things down into simpler steps and provide several brief tests perhaps instead of one long test. Again, using a recognition format for exams rather than recall. So sometimes students with epilepsy are going to do better on matching, multiple choice, those kinds of things, rather than fill in the blank and essay and short answers. Test for understanding concepts rather than specific facts, and allowing the use of graphic organizers are also great strategies for kids with epilepsy. Thematic teaching helps. It helps students when we do thematic teaching across the day. It helps students connect concepts throughout the day and skills throughout the day so that they're not in smaller chunks, so we're not doing something totally different in science and social studies and math. We have kind of a common theme that helps tie those concepts together and helps with the retrieval of information. And then making sure that they have opportunities to receive that information when they aren't overly tired or experience, of course, if they're experiencing a seizure. That might mean that we have to have an alternate way for them to get that content if they have a seizure during class. Do we have supplemental resources for them? And that's another great universal design strategy. Supplemental instruction might be provided to provide more focused look at new concepts and more practice at processing learning. Okay, let's shift over to social emotional implications. Depression is actually the mood disorder that's most commonly associated with epilepsy. ADHD is also a common behavioral problem, is considered a behavioral problem in children with epilepsy. So if you can imagine a child who has ADHD and has seizures, that's going to make learning and social interactions difficult regardless of their cognitive abilities. The anxiety disorders, there's lots of different kinds of anxiety. When we're thinking about kids with epilepsy, the most common form that they have is just generalized anxiety or generalized worrying. Several kids with epilepsy will have a panic attack or obsessive compulsive tendencies. They get into these little habits and obsessive routines in an attempt to control their environment when they kind of feel out of control because of their seizures. And impulse control problems are common among children with epilepsy. And the theory there is that area of the brain that the seizure is impacting is also this part of the brain that kind of is in charge of impulse control. So knowing that about kids can help them socially and emotionally. There is not a epilepsy and school specific journal. These are some, there's a spelling error right down here in the last one, -2 for me. But Physical Disabilities Education and Related Services is an excellent journal. It is the CEC Division for Physical and Health Disabilities. It is their journal. The Journal of School Health is a good one. That one is more targeted toward health officials, though, and not necessarily for teachers. But it is one that is related to school. These last four start drifting farther away from the school setting, but Epilepsy and Behavior has some good things. Then we have Epilepsy Research, Epilepsy Currents, Epilepsy Research and Treatment. Those are probably the least applicable in schools, but these are all journals that are dedicated to epilepsy, these last 4. The first 2 would have some articles about children with epilepsy, but they aren't journals specifically dedicated to this. Oops, that's not social emotional implication. All right, so here is the very simplest way you can write an emergency plan. Now, as you are doing your research, you may find an emergency plan template specific to your condition, and that would be much better. But if you can't find that, basically all an emergency plan is the student's name, and if you see this, do this. That's all an emergency plan is. So all these situations that are either dangerous or require additional attention, this would be what the basic emergency plan would be. So if you are thinking, what the heck am I going to do for an emergency plan for my for my healthcare plan? Look for specific templates from reputable organizations that are specific to your condition. If you cannot find that, and there are some that you will not be able to find that, then this format is fine. And then this is just the bottom. So it's if an emergency occurs, stay with the child, call or have someone else, stay with the child, call or have someone else call the school nurse. If the school nurse is not available, here are people that are trained for the emergency plan. So like I said, that's the very simplest form you could use. Now, here is an example of, and this should be full page in your handouts. This is an example of a seizure action plan. So this would be an emergency plan for a student with a seizure disorder. So as you can see, as you're flipping through, this is much more detailed, much more specific to the child with seizure disorder. All right, so that leaves us with the in-class activity for tonight. Now you have 2 choices, and I will tell you, the second choice is naturally the easier choice, and that is absolutely fine if that's what you want to do. It would be fun, maybe, if you did a 1-pager, an infographic on a seizure infographic, what to do if you see someone having a seizure. This is a nice way to, if you do have a student with a seizure disorder in your class, I might make my own infographic that doesn't, if, John has a seizure, but I might tweak my infographic to be specific to where I know all the things that John needs when he's having a seizure, and the things that are in John's emergency plan are on that, and it's in a publicly viewable place, all the places that we go, so that anybody in that setting, if John starts having a seizure, they can just look up and see this. Again, if I were making this to hang on the wall like a poster, I definitely wouldn't put his name, but I would tweak the infographic a little bit so that it did contain all the things that I know that he needed. But there are lots and lots, especially for seizure disorders, already made up infographics. An infographic is just a visual representation with some words. So this is an example, and you have the whole thing in your handout. But it's just kind of a graphical way to give a lot of information, and it tells you what to do in the event of a seizure. This is really nice, I think, to have in every classroom. And so what I would like you to do is spend a little time searching the web and try to find a seizure infographic that would be appropriate to post in your classroom or in a school. If you want to, if you have some free time, here are 2 sources. You do have to sign up for a free account that you could make your own infographic. So again, in-class activity for tonight, find an infographic and upload it. Or if you want to go the extra mile, you can make your own 1-pager. This is a nice thing to kind of have visually for people for any emergency situation that you might find in your classroom. And it's just kind of a nice, attractive way to do this, something that might tempt a person to stop and read and educate themselves. All right. So that is our very quick version of tonight's class. Took out some of the discussions we were going to have, but hopefully this is enough in a pinch to keep us all on task. If you did already submit your presentation and you want to update and submit another one, just let me know that you're going to do that, and that is absolutely fine. Again, thank you for your attention. 2 things to remember tonight: infographic for your in-class activity, and then also the emergency plan. I gave you some information on what that should look like in your healthcare plan. All right. Thanks, guys.